Hello, and welcome to the e-learning module entitled Code Blue Team Response. The purpose of this educational module is to introduce you to the code team, the medical professionals who respond to emergencies such as cardiac arrest throughout the hospital. Whether you are someone who is at the patient's bedside, assist outside the room, or an observer of a Code Blue, this module will help explain the position and role of each member of the team. There are several unique features to the code team. In this module, we will look at keys to a successful code and learn about the roles of each team member. There are several keys to a successful code. Through experience and study, several factors have been identified that can help ensure a well-run code. The first key element is performing great compressions. These should start as early as possible and be at least 2 inches in depth at a rate of at least 100 times a minute. The second principle is early defibrillation. In cardiac arrest, for any shockable rhythm, the sooner the shock is delivered, the more likely it is to succeed. Compression should be resumed immediately after shocking. The third principle is building an expert team through good communication, teamwork, and leadership. We'll learn a little more about that in the next section. While these 3 principles are simple, they are nonetheless the most crucial elements of a successful code. Many of the difficulties that the Code Blue responders may encounter can be addressed by working more effectively as a team and improving communication. To work as a team, each person must understand their role and the roles of those around them. Let's learn about the people who make up the team.
The first responder is often the patient's nurse, but it may be anyone who first discovers the unresponsive patient. The primary role of the first responder is to activate the emergency response system. This can be accomplished in many ways depending on where you are located. Know your hospital's established emergency response activation and/or call for help from others in the immediate area. If trained to do so, the first responder should then begin basic life support, focusing on delivering excellent compressions. As the code team assembles, compressions should be continuous. The second early responder should attach defibrillation pads to the patient to allow for early rhythm identification and defibrillation. Once the code team assembles, the early responder should assume a role based on their level of training and the needs of the patient.
A Code Blue response can initially seem like a hectic and confusing situation. This is not surprising, given the speed with which decisions must be made and the gathering of many different healthcare providers, some of whom may be meeting for the first time. The following diagram describes the essential Code Blue team members and their positions both in and outside the patient's room. In situations where there are too many responders, some may be asked to wait outside. This ensures that the team members can work in a controlled and calm environment. For now, let's learn about the members of the team, starting with those who are directly at the bedside. We already met the first responder. Let's look at the roles of the other providers. They include compression providers, the physician code leader, the operations nurse, an assistant physician, several nurses, including the Defib Nurse and medication nurse, a respiratory therapist, and an anesthesiologist. Let's take a brief look at each of these roles. The compression providers have one of the most essential roles at a Code Blue response, including performing compressions of appropriate rate and depth, minimizing interruptions and only pausing between compressions if instructed to do so by the code leader, creating seamless handoffs between compressionists. Good compressions are directly associated with increased patient survival independent of all other factors.
The code team leader has many roles. So many, in fact, that a separate module has been designed to teach that role. This module can be found on the UW's Learning Management System and is available for anyone to review. They are responsible for taking command of a Code Blue team, overseeing and directing the clinical aspects of the code, appropriately using ACLS guidelines.
The operations nurse is a unique leadership role held by a critical care nurse with experience in resuscitation. Working in partnership with the code team leader, the operations nurse focuses on the environment of care, cross-monitors the team, ensuring effective compressions, timely defibrillation, and advanced airway management are cared for. The operations nurse should remain hands-off, unless he or she provides a unique skill set others may not be able to perform. They prioritize tasks and facilitate delegation of responsibility. The operations nurse is responsible for ensuring each person is at the correct position around the patient, ensuring each code team member is aware of and performing their role, and assigning responsibilities such as compressions and identifying a runner if needed.
The assistant MD role may be filled by one or more additional doctors responding to the code. Responsibilities may include performing tasks delegated by the code team leader, palpating for a pulse when compressions are held, drawing an arterial blood gas and other labs if needed, performing invasive procedures, gathering additional data for the code team leader, contacting the patient's attending physician, working with the supervising RN or flow supervisor and patient's attending physician to contact and update the patient's family.
The Defib nurse's primary role is to care for defibrillation. First responders are encouraged to place pads and connect them, even if they are not trained to deliver shocks. The Defib nurse will then confirm placement and deliver shocks. Other roles of the nurse may include drawing blood, providing a cross-check for medications, cross-monitoring of their team members, and performing other delegated tasks.
The medication nurse's primary responsibility is to administer all medications, fluids, drips, and blood products. This nurse is also assigned the role of managing IVs and other lines and drawing blood from lines when needed.
The respiratory therapist's primary responsibility is to manage the patient's airway and ventilation until advanced airway management is cared for by an anesthesiologist. Respiratory therapists assist with intubation and provide specialized equipment such as the difficult airway cart.
The position for the anesthesiologist is at the head of the bed, where they provide advanced airway management and ventilation. The anesthesiologist contributes by providing critical information, as well as decisions regarding the patient's pulmonary and hemodynamic status. Since the anesthesiologist is often only present for a portion of the code blue, it is essential that this provider identifies himself or herself as the anesthesiologist when entering and leaving the room.
The providers that we have met so far are those that are at the immediate bedside of the patient. Now, let's take a look at the other members of the code team who are in the patient's room but not directly at the bedside. These include the patient's primary nurse, the recorder, the pharmacist, and the supervising MD.
The patient's nurse may play several roles that evolve over time. Initially, they may be the first responder and will be hands-on. When they are relieved of this task, they should move to a hands-off role, providing an S-bar to establish a shared mental model with the code leader, including confirming the patient's resuscitation status and sharing the situation leading up to the arrest event, as well as other pertinent parts of the patient's history, recent labs, or medications. This provider should remain immediately available throughout the code and be ready to assist other nurses as needed.
The recorder has been trained to document the events that take place during a code. It is critical that these actions are recorded in a thorough and timely fashion. It is also the role of the recorder to keep track of the time and to call out and cross-monitor when shocks and medications are due. At the end of the code, the recorder ensures all required signatures are obtained on the code blue record. The role and responsibilities of the recorder are highlighted specifically in its own training module, Code Blue Recorder, available on UW's Learning Management System.
The pharmacist's primary responsibility is to prepare and provide necessary medications and drips. They may also provide other supplies from the code cart, including ABG kits and blood draw tubes. The pharmacist provides guidance on medication dosage and administration and may offer clinical judgment regarding medications. The pharmacist may also review the list of medication the patient is or has been receiving for items that may be contributing to patient's status, such as opiates or insulin.
The supervising MD is a senior physician with great experience in resuscitation who oversees management of the resuscitation. They may offer suggestions or guidance to the code team leader. Following a code blue, it is the role of the supervising MD to lead a debriefing session with the code team members who were present, as well as any other providers wishing to join.
We've met the providers who are in the patient's room but not at the immediate bedside. These are the patient's nurse, the recorder, the pharmacist, and the supervising doctor. Now let's take a look at the providers who are outside of the patient's room. While these people do not interact directly with the patient during the code blue, they nonetheless play important roles. These providers include a supervising nurse, lab technician, public safety officer, and spiritual care provider.
The supervising nurse, or flow supervisor, is found immediately outside of the patient's room. Code blues can become overcrowded, with more providers responding than are needed. When this becomes the case, the supervising nurse is responsible for limiting entrance to essential personnel only. The supervising nurse is also responsible for obtaining a bed assignment for the patient in the event that an ICU transfer is needed. With updates from the assistant MD, the supervising nurse will contact the patient's family, if applicable. Finally, the supervising nurse can serve as liaison between those inside of the patient's room and those outside, helping to coordinate tasks and communicate information that needs to be shared between those inside and outside the room.
At every code, a lab technician arrives with a blood gas cart and waits outside of the patient's room for lab samples. The lab technician should announce their presence to a team member, usually the supervising nurse, who will alert the operations nurse and code leader. The lab tech runs blood gas samples on the portable blood gas analyzer and makes the results known to the team. For any labs that require transport to the lab tech arranges for transport of the specimens.
A public safety officer responds to all Code Blue events at Harbor Bay Medical Center and at University of Washington Medical Center. In the event of a behavioral disturbance in the area of the Code Blue, the officer is able to respond.
The spiritual care provider responds to all Code Blue events during working hours. We're also available by pager during nights and weekends. The spiritual care provider is available to offer comfort and support to family and friends of the patient.
Let's take a look at our position chart one more time and see how each team member fits into the overall scheme. We've now met all of the essential personnel involved in a Code Blue response. The coordination of these providers, who come from many different backgrounds and who may be meeting for the first time during the Code Blue, can be very complex. By understanding each person's role and through effective communication, such as with the Team Steps approach, we can form an effective Code Blue team. Thank you for watching. If you would like to view additional modules, please see the UW Medicine Learning Management System.